What if I told you that a medication you trust every day could quietly increase your risk of memory problems if it's used the wrong way? What if the very pill meant to help you sleep, calm your bladder, ease allergies, or reduce anxiety was slowly affecting the most precious part of your body, your brain? If you're over the age of 60, this is information you cannot afford to ignore. Stay with me until the end, because this knowledge could protect your memory, your independence, and your future. As we grow older, preserving brain health becomes just as important as protecting our heart. Many people worry about dementia, Alzheimer's disease, and memory loss, yet very few realize that certain commonly prescribed and over-the-counter medications may contribute to cognitive decline when used for long periods. This doesn't mean every medication is dangerous or that you should suddenly stop taking your prescriptions. It means you should understand which medicines deserve a closer conversation with your healthcare provider. One group of medications that's received significant attention from researchers is called anticholinergic medications. These drugs block a chemical messenger in the brain known as acetylcholine, which plays a vital role in learning, memory, and clear thinking. Unfortunately, as we age, our brains become more sensitive to medications that interfere with this important chemical. Anticholinergic medicines are found in more places than many people realize. Some are used for seasonal allergies. Others help with bladder control, motion sickness, muscle spasms, depression, or even sleep. Many are available without a prescription, leading people to assume they are completely harmless. But available over the counter does not always mean safe for long-term daily use, especially for older adults. Researchers have found that people who take strong anticholinergic medications regularly over many years may have a higher risk of developing cognitive impairment and dementia compared with those who use them less frequently. Scientists continue to study this connection, and while these medications do not directly cause dementia in every person, the evidence is strong enough that many medical organizations recommend limiting their use whenever safer alternatives are available. Another medication group that deserves attention is certain sleeping pills and anti-anxiety medications known as benzodiazepines. These drugs can be very helpful in specific situations and under careful medical supervision. However, using them for months or years may increase the risk of confusion, falls, poor concentration, and ongoing memory difficulties in older adults. In many cases, healthcare providers now recommend using these medicines only for short periods whenever possible. One of the biggest mistakes people make is assuming that if a medication worked well years ago, it must still be the best option today. Our bodies change with age. The liver and kidneys process drugs more slowly. Medications remain in the bloodstream longer, and the brain becomes more vulnerable to side effects. A dose that was perfectly acceptable at age 40 may affect someone very differently at age 75. Polypharmacy, which means taking multiple medications at the same time, creates another challenge. Many older adults take medicines for blood pressure, diabetes, cholesterol, arthritis, stomach problems, sleep, and allergies. Even if each medication is appropriate individually, the combination can sometimes increase confusion, dizziness, or memory problems. This is why regular medication reviews with a physician or pharmacist are so valuable. If you're caring for an aging parent or grandparent, pay attention to subtle warning signs. Are they becoming more forgetful after starting a new medication? Are they more sleepy during the day? Are they struggling to concentrate or feeling unusually confused? These changes deserve medical attention, especially if they appear shortly after a medication change. Here's something incredibly important. Never stop a prescribed medication on your own. Suddenly stopping certain medications can be dangerous and, in some cases, life-threatening. Instead, schedule an appointment with your healthcare provider and ask a simple question. Is this medication still the safest option for someone my age? That single conversation could make an enormous difference. Many medications now have safer alternatives with fewer effects on memory. Sometimes a different drug, a lower dose, or a non-medication approach such as physical therapy, better sleep habits, bladder training, allergy prevention, or stress management may provide similar benefits with less risk. Every person is different, and treatment should always be individualized. Protecting your brain also goes beyond medications. Staying physically active, eating a balanced diet, controlling blood pressure and diabetes, getting quality sleep, remaining socially engaged, exercising your mind through reading and learning, and avoiding smoking all support long-term brain health. These habits work together with appropriate medical care to help preserve memory as you age. Save lives every single day. They control chronic illnesses, relieve pain, and improve quality of life. The goal is not to fear medicine, but to use it wisely. The right medication at the right dose for the right person under proper medical supervision is one of the greatest tools modern medicine offers. So if you or someone you love is over the age of 60, take a few minutes this week to review every prescription, over-the-counter medicine, vitamin, and supplement with your healthcare provider. Ask whether each one is still necessary, whether safer alternatives exist, and whether any could be affecting memory or thinking. Being proactive today may help protect your brain for years to come. Your memory is priceless. Your independence is invaluable. The choices you make today, including understanding your medications, can have a lasting impact on your health tomorrow. Stay informed, ask questions, and never hesitate to advocate for your brain health. Long-term use of certain medications has become an important area of research in brain health, particularly among older adults. One group of medicines that has received significant attention is known as anticholinergic drugs. These medications work by blocking the action of acetylcholine, a chemical messenger that plays a vital role in memory, learning, attention, and communication between nerve cells in the brain. While these drugs can be very effective for treating specific medical conditions, their effects on the aging brain may become more noticeable when they are used regularly over long periods. As people grow older, the brain naturally produces lower levels of acetylcholine, making it more vulnerable to medications that further reduce its activity. This may lead to symptoms such as forgetfulness, slower thinking, confusion, difficulty concentrating, and problems with daily tasks. Strong anticholinergic medications are commonly found in treatments for allergies, overactive bladder, motion sickness, depression, muscle spasms, and some sleep problems. Because many of these medicines are available over the counter or have been prescribed for years, some individuals continue taking them without realizing they may affect cognitive function. Large observational studies have reported that prolonged exposure to high levels of anticholinergic medications is associated with a greater likelihood of developing cognitive impairment or dementia in some older adults. However, this research shows an association rather than proving that these medications directly cause dementia in every person. Factors such as overall health, age, existing medical conditions, genetics, and the total number of medications being taken also influence an individual's risk. For this reason, healthcare professionals encourage regular medication reviews to determine whether the benefits of a medicine continue to outweigh its potential risks. In many cases, safer alternatives or lower-risk treatments may be available, allowing patients to manage their health conditions while reducing unnecessary exposure to medications that could affect memory and thinking over time, helping preserve cognitive function and quality of life as they age. Many older adults take medications every day to manage common health conditions such as allergies, overactive bladder, insomnia, depression, or anxiety. These medicines often provide important benefits and can greatly improve quality of life when used appropriately. However, some of them may also affect brain function, particularly in seniors whose bodies process medications more slowly than they did at a younger age. As people age, changes in the liver, kidneys, and brain make older adults more sensitive to certain drug effects, increasing the likelihood of side effects involving memory, attention, and mental clarity. Some allergy medicines, especially older antihistamines, can cause drowsiness, slowed thinking, and confusion because they affect chemicals in the brain responsible for alertness and memory. Certain bladder medications used to control urinary urgency or incontinence may also reduce the activity of acetylcholine, an important neurotransmitter involved in learning and memory. Sleep aids, particularly those intended for regular use, may leave older adults feeling groggy during the day, impair concentration, and increase the risk of falls and cognitive difficulties. Some antidepressants, especially those with strong anticholinergic properties, can also contribute to confusion or memory problems in susceptible individuals. Anti-anxiety medications, particularly benzodiazepines, may slow brain activity, leading to reduced alertness, slower reaction times, impaired coordination, and difficulty forming new memories, especially when used for extended periods. The effects may become even more pronounced when several of these medications are taken together, increasing the overall burden on the brain. It is important to understand that these medicines do not affect everyone in the same way, and many people use them safely under proper medical supervision. The risks often depend on factors such as age, dosage, duration of treatment, overall health, and the presence of other medical conditions. For this reason, healthcare providers recommend regular medication reviews to identify safer alternatives whenever appropriate and to ensure that every medication continues to provide more benefit than risk for maintaining healthy cognitive function in older adults over time. Many older adults take prescription medications every day to manage chronic conditions such as high blood pressure, diabetes, heart disease, arthritis, depression, or anxiety. These medications are often essential for maintaining health, preventing complications, and improving quality of life. Because of this, it is extremely important that seniors never stop taking a prescribed medication without first consulting a qualified healthcare provider. Although concerns about side effects or news reports about certain medications may cause worry, stopping a medication suddenly can sometimes be more dangerous than continuing it. Some medicines require the body to adjust gradually when they are reduced or discontinued. Abruptly stopping certain blood pressure medications can lead to dangerously high blood pressure, while suddenly discontinuing anti-anxiety medicines or some antidepressants may result in withdrawal symptoms, increased anxiety, sleep disturbances, or other serious health problems. Medications used for heart conditions, seizures, or chronic pain may also cause significant complications if they are stopped without proper medical guidance. Healthcare providers consider many factors before deciding whether a medication should be continued, changed, or discontinued, including a person's age, medical history, current health conditions, kidney and liver function, and the other medications they are taking. In many cases, if a medicine is no longer appropriate, the healthcare provider can recommend a safer alternative, lower the dosage gradually, or develop a step-by-step plan to reduce the risk of withdrawal or other complications. Seniors should also inform their doctor about every prescription medication, over-the-counter medicine, vitamin, herbal supplement, and natural remedy they use, as these products can interact with one another and affect treatment decisions. Open communication with healthcare professionals allows medications to be reviewed regularly, ensuring that each one continues to provide more benefits than risks. Asking questions about possible side effects, memory concerns, or alternative treatments is encouraged and helps patients participate actively in their care, while avoiding unnecessary health risks associated with making medication changes without professional supervision and individualized medical guidance. As people grow older, it is common for them to take several medications at the same time to manage chronic health conditions, such as high blood pressure, diabetes, heart disease, arthritis, osteoporosis, or digestive problems. In addition to prescription medicines, many seniors also use over-the-counter products, vitamins, herbal supplements, allergy medications, pain relievers, and sleep aids. While each medication may serve an important purpose, taking multiple drugs together can increase the risk of side effects, harmful interactions, dizziness, confusion, falls, and memory problems. For this reason, healthcare experts recommend that older adults have all of their medications reviewed regularly by a doctor or pharmacist. During a medication review, healthcare professionals carefully examine every product a person is taking, including prescription medicines, non-prescription drugs, supplements, and natural remedies. They evaluate whether each medication is still necessary, whether the dosage remains appropriate, whether two or more medications are performing the same function unnecessarily, and whether any combinations could increase the risk of unwanted effects. Because the body's ability to process medications changes with age, a treatment that was once appropriate may no longer be the safest choice years later. A medication review also provides an opportunity to identify newer therapies or safer alternatives that may be equally effective, while carrying a lower risk of confusion, drowsiness, or cognitive impairment. In some cases, healthcare providers may recommend reducing the dose of a medication or gradually discontinuing one that is no longer needed, a process known as deprescribing, which is done carefully to avoid withdrawal symptoms or worsening of medical conditions. These reviews also encourage patients to discuss any new symptoms they have noticed, such as memory changes, fatigue, or balance problems, which may actually be related to medication side effects rather than aging itself. Regular medication reviews help ensure that every medicine continues to provide meaningful benefits while minimizing unnecessary risks, supporting safer treatment, better overall health, improved quality of life, and healthier aging through personalized medical care and informed decision-making. Older adults should pay close attention to any unexpected changes in memory, thinking, or alertness after starting a new medication or changing the dose of an existing one. While some people assume that increasing forgetfulness or confusion is simply a normal part of aging, these symptoms can sometimes be side effects of medication rather than signs of permanent cognitive decline. Certain prescription and over-the-counter medicines may affect how the brain functions, particularly in seniors whose bodies process medications more slowly. As a result, drugs may remain in the body longer, increasing the likelihood of side effects that involve the brain and nervous system. Symptoms such as increased forgetfulness, confusion, difficulty concentrating, excessive daytime drowsiness, slowed thinking, trouble following conversations, unusual mood changes, or problems completing familiar daily tasks should never be ignored. In some cases, these symptoms may appear within days of starting a new medication, while in others they may develop gradually over several weeks. The risk can also increase when multiple medications are taken together, creating drug interactions that affect mental clarity or balance. Family members and caregivers often notice these changes before the individual recognizes them, making their observations especially valuable during medical appointments. Reporting these symptoms promptly allows healthcare professionals to determine whether the medication, the dosage, an interaction between drugs, or an underlying medical condition is responsible for the cognitive changes. A doctor or pharmacist may recommend adjusting the dose, switching to a safer alternative, or conducting further evaluations to rule out other causes such as infections, dehydration, vitamin deficiencies, or neurological conditions. Early recognition is important because many medication-related cognitive side effects can improve once the underlying cause is identified and managed appropriately. Ignoring these warning signs may increase the risk of falls, medication errors, accidents, hospitalizations, and reduced independence. Maintaining open communication with healthcare providers whenever new symptoms appear helps ensure that treatment remains both safe and effective while protecting memory, mental function, daily independence, and overall well-being throughout the aging process. Protecting brain health involves much more than taking the right medications. Daily lifestyle habits play a powerful role in maintaining memory, thinking skills, and overall cognitive function as people grow older. Regular physical activity is one of the most effective ways to support a healthy brain because it improves blood circulation, increases oxygen delivery, and helps nourish brain cells. Exercise also reduces inflammation, supports heart health, and lowers the risk of conditions such as obesity, high blood pressure, and type 2 diabetes, all of which have been linked to a greater risk of cognitive decline. A nutritious diet rich in fruits, vegetables, whole grains, lean proteins, healthy fats, nuts, and fish provides essential vitamins, minerals, and antioxidants that help protect brain cells from damage caused by oxidative stress. Foods containing omega-3 fatty acids and other beneficial nutrients may also support memory and learning. Quality sleep is equally important because the brain uses this time to repair itself, strengthen memories, and remove waste products that accumulate throughout the day. Poor or interrupted sleep over long periods has been associated with reduced concentration, slower thinking, and an increased risk of memory problems. Managing blood pressure and diabetes is another essential step, as uncontrolled levels can damage blood vessels that supply oxygen and nutrients to the brain, increasing the likelihood of stroke and vascular cognitive impairment. Staying socially active by spending time with family, friends, or community groups helps reduce loneliness and depression while encouraging communication and emotional well-being. Mental stimulation through reading, learning new skills, solving puzzles, playing musical instruments, or participating in educational activities challenges the brain and supports the development of new neural connections. These healthy habits work together to strengthen both physical and cognitive health, creating a comprehensive approach to healthy aging. Although no lifestyle choice can completely eliminate the risk of dementia, consistently following these practices can help preserve memory, improve daily functioning, enhance quality of life, and support long-term brain health throughout the aging process.